Hello, Bio 130 students. This will be the video on the respiratory system's various common respiratory diseases. And well, typically since it affects the lungs, we will often hear about them. Many of these affect many of us. Well, one example of a respiratory illness would be asthma. It's not a illness that can actually be passed person per person in the way that, say, a cold could, not infectious in that scenario. It is chronic and it typically involves inflammation, edema, and bronchospasms, which inflammation, uh, the overactive response of the immune system, edema, where fluid builds up, and bronchospasms, where where the bronchi are vibrating in a non-productive way. Due to constrictions and or fluid blocking the airways into the lungs, this process of asthma can essentially make it more difficult to actually breathe. And some triggers can just be dust, pollen, allergens. Some people gain a sense of asthma by getting stung by a insects like a hornet or a bee. And well, even infections can sometimes cause these in more susceptible people. There is a simple method of diagnosis, diagnosis, which includes measuring the pressure that someone can actually can exert with their lungs by exhaling, by breathing out, or testing a response to a known bronchial constrictor. For example, if a medical professional gives you a little bit of methacholine, that will cause your bronchial tubes to constrict, to tighten up, which if you're someone who is prone to asthma, this would cause some pretty hearty coughing, some pretty hard difficulty of breathing. Whereas someone who does not typically have asthma, it might only cause some minor discomfort. And well, common treatment, typically a pretty more simpler illness to actually help with, is taking a corticosteroid. Now, some other common diseases which can be confused for one another would be bronchitis and pneumonia. Bronchitis is simply inflammation of the bronchial linings, and usually bronchitis is your body's response, or I should say is a symptom of a viral infection in the lungs or in the bronchial tubes. Now, pneumonia, which can give some of the same symptoms as bronchitis. Pneumonia is typically a more awful disease, and it is caused by a bacterial infection of the lungs. Just a nice little Venn diagram, basically showcasing some differences and similarities of bronchitis and pneumonia. Both of them, well, whether it's a virus infection in bronchitis or a bacterial infection in pneumonia, both of them can often cause a victim to feel colds, chills, make it hard to breathe, and also cause pain in the chest. But some things where they differ is that pneumonia will cause stronger fevers, a very productive cough, a cough that's producing a lot of mucus, and will often be the one that will make people suffering from it much more tired and fatigued. Whereas bronchitis, some stuff unique to it would be it will cause a sore throat and a persistent cough, which is more dry than, say, pneumonia, which would have been producing mucus. And as opposed to fatigue, bronchitis results in a lot of body aches being noticed throughout the body. So, on, say, another test for a compare and contrast, you will most likely definitely see bronchitis and pneumonia, where a compare and contrast would be A contrast could be one is by a bacteria, where the other is by a virus, and in comparison, they both cause shortness of breath, or they're both illnesses of the respiratory system, things like that. And well, as part of being basic anatomy, there are plenty of other respiratory illnesses that can be discussed, and that'll be more for the discussion sections for you guys to go over. I look forward to reading those as always.